And welcome again. I'd like to speak to you about the subject of sleep in cranial sacral therapy and share some insights with you about how this work with CST can help very much in terms of allowing our bodies and brain to become more robust and healthier, and how this also relates to memory problems. So you remember or recall, if you happen to see the last blog, that I talked about the glymphatic system. That system of networks of billions of cells in the body that offer a pathway for the flow of cerebrospinal fluid and extracellular fluid to basically drain toxins from the brain. And one of the things that researchers have found in the glymphatic system is that it works most effectively during sleep. That's where about 60% of its work gets done. So that very restorative stage 3 and 4 sleep occurs, and it's as if the brain needs a time to shut off and rest for these toxins to be released from the brain. So it makes sense that the deeper the sleep, the more that glymphatic system can do its job. So that's the good news. However, there's some things that maybe a lot of us are aware of, and that is that there's about 50 to 70 million people, according to Research American Sleep Council and others. There's about 50 to 70 million Americans that have some form of sleep disruption or insomnia. And according to research in the American and Canadian Medical Association, in seniors over 65, as many as half of them have some form of insomnia or sleep disruption. And you can imagine what the consequences of this insomnia have and how this might affect memory. It really aggravates their situation. So some of the symptoms of less sleep in seniors and others is that sleep gets broken up. It's more fragmented. And as people get older, it's more easily, any little disruption can fragment or change their sleep. There can also be reduced REM or rapid eye movement sleep. And seniors, their biomechanical rhythms tend to shift, and seniors tend to want to go to sleep earlier, but also wake up earlier. And I know that in the villages down in Florida, someone told me a story about seniors that will call the people that deliver the newspapers at 4 in the morning if the newspapers are 5 minutes late, only because they're awake so early, they're ready to read their newspapers in the morning. So that's a symptom of that. But also it's just that sometimes people wake up earlier. Their rhythm changes as their nocturnal rhythms and their rhythms during the day really shift. Now, one of the things that happens also as people get older is there can be delayed onset of sleep. It takes people longer to go to sleep. And they have less recuperative sleep, which is called stage 3 and 4, where a lot of the rest and repair within the brain takes place. So that's a consequence of aging. And with that, of course, what can happen is there can be decreased mental functioning, and there's even greater irritability. As people, which makes sense, any of us that have had less sleep, we tend to be a little edgier and more irritable. So that can happen as a chronic condition over time, especially as we age. Now, along with that, as well as the short-term consequence of irritability, then that can affect our mental functioning and clarity, which makes a lot of common sense. But long-term, this can also correlate to the formation of longer-term memory problems, such as what occurs with Alzheimer's and dementia. And along with that, researchers have found that on the average, if people sleep less over a longer period of time, like over a 25-year period, that statistically they will die at a younger age. So there's a longer-term consequence as well, as including, of course, the quality of life. This can impact, obviously, our quality of life as well. Now, here's some good news. When we're talking about cranial sacral therapy, one of the benefits of cranial sacral therapy is that it can allow the whole nervous system to settle down. It allows the body to go from what's called sympathetic or highly driven tone into parasympathetic tone, where there's greater rest and relaxation. And it's not uncommon that when we treat people, excuse me, what will happen is that they will actually go to sleep during a treatment and you can tell they're catching up on some deeper sleep. And the benefit of that is that very often when a patient goes home, then they're able to go to sleep easier at night and stay to sleep longer, sometimes having a deeper and more restorative sleep than they've had in months or even years. So there's a real benefit. And correlating to that, we found that using such techniques as the craniosacral still point and other techniques, that their connective tissue relaxes. There's more toxins drained from the body. There's a lowering, again, of sympathetic tone and even a lowering of blood pressure, so it can affect hypertension, which can also be correlated more with people as they age. And you can imagine if people are able to enter sleep more easily and stay there longer, this actually allows this lymphatic system that we've been discussing to do its work more efficiently. Simply, the deeper the sleep somebody has, the greater drainage the lymphatic system has in the body, and more of those toxins, which can prevent the formation of amyloid plaques and tangles, to take place. So that's just a little sharing of what sleep can do in terms of aiding this lymphatic system and other anatomical parts of the body. So in the next slide, we're going to talk a little bit more about the brain and the gut and the immune system together. So stay tuned, and we will talk to you again soon.